Welcome to yet another episode of Diabetic Care India. In our endeavor to create awareness on diabetes, we set up Diabetic Care India around 1.5 years back, and thanks to each one of you watching this program, your continuing support and encouragement have brought us where we are today with over 1.5 lakh subscribers and nearly 3 million minutes of views, which is phenomenal for a channel that deals with only one subject, that is diabetes. In today's episode, I'll be dealing with a problem that most diabetics face at least once in their lifetimes. And at times, this particular problem could become even life-threatening for them. It might sound simple, but then it has been a very dangerous problem prevailing in diabetics and something that many find extremely difficult to handle. And that problem is called hypoglycemia. I'm sure you have heard this term, hypoglycemia. And I'm sure many of you would know what exactly it means. It just means that your blood sugars have dropped to dangerously low levels. So what is that level? We need to have a clear cutoff, don't we? Yeah. So that level is 70 milligrams percentage of blood glucose. So a blood glucose level of less than 70 milligram percent will be denoted as hypoglycemia. And anything less than 56 milligrams percentage of blood glucose will be denoted as severe hypoglycemia. So, now that we have given the cutoffs, let's just look at what causes hypoglycemia. Obviously, hypoglycemia can occur even in non-diabetics. It's not like hypoglycemia takes place only in patients who are on treatment for diabetes. It happens even in non-diabetics. So if you have not had your food for several hours and you have been running around, you might feel giddy, you might feel palpitations, you might feel tremors in your hands, right? I'm sure many of us have gone through that in our school days when we used to skip our food and then run around or play around for several hours. So that was hypoglycemia. But then when the same thing happens to a diabetic, especially a diabetic who has suffered the disease for a pretty long period of time, then that causes all sorts of dangerous consequences. So let's look at what causes hypoglycemia. So as we said, not taking your food on time can cause hypoglycemia even in people who are not diabetics. In people who are on diabetics, again, the same reason. In addition to that, all the medicines given for the treatment of diabetes can cause hypoglycemia. It's not just insulin alone. Please keep that in mind. It's not just insulin or your Dionyl, that is glibenclamide, or the category of drugs known as sulfonylureas, which are notorious for causing hypoglycemia. They are not the only ones that can cause hypoglycemia. In fact, each and every medication that is given for the treatment of diabetes can cause hypoglycemia. And there are some medicines which are not given for diabetes, again that can cause hypoglycemia. There are medicines. So it's not like only the diabetic medications can cause hypoglycemia. Many of the other drugs can also. So some antibiotics can cause hypoglycemia. Alcohol is another cause of hypoglycemia. Alcoholics have frequent episodes of hypoglycemia. So what we need to realize here is, in order to figure out the reason for the hypoglycemia, we need to look at all these aspects. Strenuous exercise is another reason for hypoglycemia, especially when it is unaccustomed. A person who has not been exercising regularly decides to start exercising one fine day. All right, he then does a 1 hour long bout of very strenuous exercises. That's a perfect recipe for hypoglycemia. So on the one hand, you have erratic eating habits, that is eating timings which are not conducive. 2, you have medicines, all the medicines given for diabetes and also some other medicines can cause hypoglycemia, including alcohol. All right. 3, strenuous exercises. 4, there are reasons which are not easy to pinpoint. For instance, some patients have certain types of tumors, rare tumors known as insulinomas. So as the name suggests, these tumors produce and secrete insulin without the control of any higher centers. They go erratic, they go crazy, and they start producing and secreting insulin. That can cause frequent hypoglycemias, but they are rare, fortunately. So, right? Okay, let's look at the commonest causes. So, either food, don't take food for a long time, you are asking for trouble. Whether you are a diabetic or a non-diabetic, and the danger being much higher for diabetics. Now, let's look in detail at the medications that diabetics takes that can cause hypoglycemia, obviously. So, first on the list would be insulin. Insulin is the number one and the most potent cause of hypoglycemia. And in many instances, it is not dose dependent. So, what does that mean? Even 1 unit or 5 units, a small shot of insulin can cause hypoglycemia in certain individuals. You don't need to take a huge dose of insulin like several hundred units, not required. Even a small shot of insulin is enough to cause hypoglycemia in certain people. Amongst the tablets that we are then there is before I go to the tablets, I'll talk about an injectable that is given in diabetics other than insulin. It's called a GLP-1 analogs. They can cause hypoglycemia, but to a far lesser extent than insulin or even the other tablets. So, hypoglycemia due to GLP-1 analogs is extremely unusual, but happens. Now, let's go to the oral medications, the tablets. Amongst the tablets, most notorious for causing hypoglycemia would be the sulfonylureas. So, what are the sulfonylureas? Glibenclamide, glimepiride, glyclazide, of which glyclazide has the least chances of causing hypoglycemia, while glimepiride and glibenclamide have very high chances, and glyclazide has a medium chance. And glipizide also is another sulfonylurea, but not very commonly used in India to the extent of glimepiride or glyclazide. So I don't want to talk much about that. What about the most commonly used oral medication in diabetes? That is metformin. Can it cause hypoglycemia or not? That's a $1 million question which many of my patients keep asking me on and off. Yes, metformin can cause hypoglycemia. So if someone told you that it's metformin after all, you'll be safe, you can have food whenever you feel like, wrong. Please don't believe that metformin, because metformin can cause hypoglycemia. I keep seeing patients who go into hypoglycemia after having had metformin. So I make it a point to prescribe metformin only after food. What about pioglitazone? So pioglitazone was in the news for all the wrong reasons a couple of years back. It used to be a controversial medication. People were worried about the risk of bladder cancers, but then it was proven that pioglitazone is not as bad as it is made out to be. It's not a villain. It is in fact a fantastic insulin sensitizer, and given in the right patients, it works brilliantly. What about pioglitazone? Pioglitazone doesn't cause hypoglycemia to the extent of sulfonylureas, but yes, it does cause in certain individuals. What about stuff like voglibos? That's the AGIs. We call them the AGIs, alpha glucosidase inhibitors. Could they cause hypoglycemia? Yes, they can cause hypoglycemia. Suffice it to say that all the medications, including the newest kids on the block, namely DPP4 inhibitors, and they were the first ones, followed by the SGLT2 inhibitors. SGLT2 inhibitors also have a very low risk of hypoglycemia, but they can cause hypoglycemia. So it's not right to believe that one particular medication will never cause hypoglycemia. All of them do, all of them. But only to the degrees might vary from each other. So while you have insulin and sulfonylureas right at the top, followed by metformin and perhaps other medications, but then they do cause. So what is the best way to prevent hypoglycemia? Have more frequent meals in a day, divided amounts, or rather than having 3 meals which are separated by huge, very lengthy gaps. That's not a good idea. So let's assume that a person takes breakfast at 8 a.m. or 8:30 a.m. and then he or she takes lunch at 2 p.m. and then dinner at 10 p.m. or 9 p.m. whatever. So over here in the morning hours, this person goes without food for as much as 6 hours. 8:30 to 1:30 or 2 o'clock is almost 6 or 5.5 to 6 hours. And then after lunch, he or she goes without food for around 8 hours or 7 hours. Mind you, during this period, he or she doesn't sit in a place. They would be working, they would be running around, they would be physically active, and they would have popped in their medications too. That's a perfect recipe for disaster. The symptoms vary from each other. Not all people with hypoglycemia have similar symptoms, but the common get to hear are tremors, palpitations, headaches, nausea, sweating, profuse sweating, sudden feeling of tiredness and fatigue. The throat goes dry in certain individuals. And in certain people, even when they have blood sugars of 100 or 120, that's much more than the cutoff for hypoglycemia, right? I began by telling you about the cutoff, that is 70 milligrams per deciliter of blood. But even with relatively high blood sugar levels, say in the range of 120 milligrams per deciliter, certain individuals do have symptoms of hypoglycemia. That's called relative hypoglycemia. I'm not going to talk about that in this particular episode, maybe perhaps in another one. This can also happen. So the symptoms, as I told you, can keep varying from person to person, but once the blood sugars drop to less than 56, then it becomes extremely dangerous. It can kill. Hypoglycemia can be fatal, especially in people with pre-existing cardiac disease. Hypoglycemia can precipitate fatal arrhythmias and can even cause death of the person. Hence, hypoglycemia needs to be immediately recognized and treated. So, how do you treat hypoglycemia? Very simple. It's a no-brainer. I don't need to tell any one of you how to treat hypoglycemia. Whatever sweet stuff that you can grab, immediately grab it and pop it into the mouth. That will buy you some time. But hold on. Just popping in a sweet or a spoonful of sugar or a piece of jaggery does the trick only for a few minutes, because after that few minutes you will go in for another profound episode of hypoglycemia. In order to prevent that, as soon as you finish having the sweet and you feel better, that it should happen within a few minutes. Usually the person recovers in a few minutes time. Have a full regular meal. That's extremely important. Don't skip this. Many people who go in for hypoglycemia immediately pop in the sweet or whatever, and then they forget all about it. In a less than an hour's time, they are back with another bigger episode of hypoglycemia. So in order to prevent that from happening, once you pop in your sweet and you start feeling better, immediately go and have a proper meal. And then as soon as possible, meet up with your doctor, and perhaps he or she might advise you to change your medications or adjust the doses of your insulin, as might be the case. So hypoglycemia, I hope we do this spontaneously, all these videos. We don't have any prepared script. I don't read from any sheet of paper, and it's extempore. So pardon me and forgive me for lapses that might creep in. Pardon me for that. If I have left out any topic, please feel free to remind. You are welcome to post your comments and your remarks and your suggestions for improving the quality of this program even more. Ultimately, it's all about you. It's all about what you need. It's all about what you require and what would help you lead a better, healthy and happier life. So we would like to hear from you. Please come back to us with your valuable feedback. We'll be waiting for it. In the meanwhile, don't forget to share this video with your friends and your relatives and your well-wishers and your acquaintances. May they also benefit from the information that we would like to share with them. And please do press the bell icon. That's your notification icon. That will keep you in the loop. That will keep you updated about the new videos that we post from time to time. Thank you so much for listening to us, and thanks a lot for being with us. Thank you so much.